Dr. Cornelius Woelk first began working with cancer patients over 25 years ago, when, after finishing his residency, he moved to the Mordenwinkler area. Dr. Woelk and his team from Boundary Trails Hospital have played a key role in the improvement strategy for the cancer care journey.
It was probably in about 2000, 2001 that we started really sensing that we had quite a large cancer population. It was growing, and they were having trouble accessing care initially. So we would diagnose a new cancer patient, and we weren't able to get them to see the specialist quickly enough. And then when we were able to get them in, they often came out with an order for more tests. And of course, you wait to see the specialist, you wait to see the tests, then you wait to see the specialist again about the results, and then you wait for your treatment, etc. And we said, this can't be happening. And so we looked at our own situation and said, how can we change this? One of my colleagues, Dr. Bob Menzies, and the nurse who was in charge of the department at the time, Cheryl Penner, and I worked at this project that we called the pre-referral project. So, as the name suggested, it had to do with seeing us or the nurse before the time of referral to Winnipeg.
The pre-referral project involved lining up all the patient's tests at the same time and developing a cohesive treatment plan.
My biggest mantra for a long time was that we needed to get concurrent waiting instead of consecutive waiting. If you're going to wait for 5 things, why do you have to wait for one before you can start waiting for the other? Let's wait for them at the same time. And eventually, I think that will shorten the cancer journey. It won't make it into days, but hopefully it'll make it into weeks.
This speeding up of the process, it obviously helps the patients getting into treatment more quickly, but does it also help the psychological aspects? Is it more one than the other?
That's a good question. The studies do show that people who have to wait longer don't have as good an outcome, but it's hard to quantify that in terms of days or exact weeks. We know that if you wait a number of months longer, your outcomes are going to be worse. But by far, the improvement is on the psychosocial aspects of things. The worry that people have is incredible. They describe to me their sweatiness and their just waiting in the clinic for somebody to come and tell them what the result is a time of great stress.
Not just for them, but for their families.
For everyone involved. That's exactly right.